So I'm really pleased that I got to present some initial data. So I'm a respiratory registrar doing my PhD, sponsored by NIHR Doctoral Fellowship and Booth Strauss Foundation. And we got some data from the National Lung Cancer Registry, which I think it's the largest cohort of never smokers with lung cancer in Europe. So we've got about 10,000 people who have never smoked with lung cancer. And the majority of whom are women, so about 66%, 84% of whom are white, which is actually a bit less than we would expect when we compare to sort of the ethnic makeup of the UK. And really crucially, 2/3, so about 66% are diagnosed at a late stage, stage 3 and 4. And then when we look at sort of factors that are associated with the late stage diagnosis, and the reason why late stage diagnosis is so important is because when you're diagnosed late, you're far more likely to die from lung cancer. And the factors that are associated with that late stage diagnosis is being younger and being male. And then when we look at, even when we adjust for stage, when we look at factors associated with dying from lung cancer when you're a never smoker, we have older people, male, and interestingly, people from Asian, Black, and other ethnicities are less likely to die from lung cancer. Really crucially, stage is very important. So with every 1 increase in stage, for example, stage 1 to 2, you double your risk of dying from lung cancer as a never smoker. And I think that's really important. So we know that the majority of never smokers are being diagnosed at a late stage when they don't have any early diagnosis interventions in the UK. This is something that we really need to do something about.